Good morning. Going to talk about the belly button aspect of a tummy tuck. I'm Dr. Dumestre, board certified plastic surgeon. So the question is, why do the belly buttons look so bad after some tummy tucks? So the belly button is definitely the hardest part of the tummy tuck as far as getting a nice tucked in belly button that doesn't have the outer rim of scar. So typically when people are talking about the bad belly buttons after a tummy tuck, they're referring to ones where you can see a visible ring of scar around the belly button, or if you get pooching of the belly button, which can be an indication of a small hernia. So what is the belly button? So the belly button is actually a stalk that is anchored to your abdominal wall and then basically lives in the abdominal skin. So when you look at it from a side view, you've got your abdominal muscles and then you have this stalk, and then that's the visible part of the belly button that is living in the skin. If you have an outie belly button, that means that you have a small umbilical hernia, a belly button hernia, where a little bit of fat from your insides, so the fatty tissue around your organs, actually comes into the belly button, pushes it out, and gives some of that pooching. So that is what an outie belly button is. So in a tummy tuck, because we are removing the skin and fat that goes from the belly button down, what happens is that belly button skin, the visible part, is separated, and then all of that skin is removed. So then I'm basically looking at empty space here. I've got the stalk of the belly button that's just kind of dangling there, and then you have your skin from the belly button up that's ultimately going to be lifted and stretched to now be your whole belly. So then we've now stretched that skin, it's there, but it doesn't have the belly button popping through. So a little opening is made and that belly button stalk gets popped through. Now, there's a few options for closing the belly button, and it also depends on people's preference. So you can make a nice kind of half moon shape one, you can make a more oval belly button, or sometimes if people have a very damaged belly button, say you've had multiple surgeries that have gone through there, I'll take off that belly button stalk completely and make you a new belly button, which is basically referring to a scar that is nicely tucked in with a little bit of hooding of the tissue on top. So basically we're trying to take this stalk. If we're using your real belly button, then I try to shrink it down. I tack that stalk down so that I'm just left with a little bit of belly button skin at the base. That way, when we're closing it, my goal is that all of that scarring stays really deep down and all of the skin edges come to heal down in that center. The tighter that you make the belly button, the more it can have wound healing issues. So it can take, it's pretty common to have some oozing, take some time for that to heal, which I don't mind because then it can cinch in at the same time, keeping that scarring at the base. When the belly button is popped out too far, that's when it can leave that rim of scarring around it. Or if there's an unrecognized hernia, then that's when sometimes you can get persistent pooching of the belly button that looks kind of funky after the tummy tuck. Sometimes, despite all of my best efforts, there's some issues with the healing there. It doesn't look great, and we need to do a touch-up or a revision to fix it and get that belly button nice and cinched in. As far as the poor quality belly button, so if you have a really thin belly button, it doesn't have good blood flow to it, it can be sometimes really flat, it doesn't have good contour, that's when I like to just take it off, especially if you've had a lot of weight loss. That stalk can be really long and hard to shrink in enough, and then just make you a really beautiful neo-umbilicus is what we call it. Hope that helps. Have a great day.